Hello everyone, this video is about the gross anatomy of the nose and about its applied anatomy and is presented by Dr. Lakshmi Gayathri. Nose is primarily meant for olfaction, that is sense of smell. It is the first part of the upper respiratory tract and is also responsible for warming, humidifying and acts as an air conditioning chamber for the air which is inspired by us. It also protects the air passages by filtering the foreign particles with its coarse hair present in the vestibule, and also provides a mucociliary barrier which entraps the particles and moves it backwards to the nasopharynx, which is then ejected by sneezing or coughing. Thus, nose is helpful in so many ways. Let us go into the video to look into the gross anatomy of the nose. The most prominent part of the face is the nose, which is a pyramidal shaped structure located in the midline of the mid-face and is attached to the facial skeleton. Its upper part is continuous with the forehead. Basically, we study nose by dividing into an external nose and its nasal cavity. There are two nasal cavities which is separated by the midline nasal septum. Each nasal cavity contains a vestibule, a roof, floor, a lateral wall and a medial wall or the nasal septum. Let us first study about the external nose. As already told, the external nose is a pyramidal projection of the face. It has the following parts. It has a root which is present at its junction with the forehead, a tip or apex present at its free part, and a rounded medial border running between the tip and the root. On either side of the medial border is the dorsum or the lateral surface of the external nose. In its inferior surface or the base or the lower part, there is a pair of pyriform apertures called as nostrils or nares or the anterior opening of the nasal cavity. The framework of the external nose is made up of bones and cartilages. Let's see what are the bones and cartilages making up the external nose. The upper part of the external nose is supported by the bones and the lower part or the inferior surface below the bones is of pyriform aperture which is filled with the cartilages. This pyriform aperture is bounded above by the two nasal bones. Superolaterally on either side of the nasal bone is the nasal part or the nasal notch of the frontal bone. Lateral to the pyriform aperture is the frontal process of the maxilla. Thus, the bony framework of the external nose is formed above by the nasal bone, superolaterally by the nasal notch of the frontal bone and laterally by the frontal process of maxilla. The cartilages which fills the pyriform apertures are the upper lateral nasal cartilage, lower lateral cartilages or the major alar cartilages, some minor alar cartilages and the anterior border of the septal cartilage. The upper lateral nasal cartilage is triangular in shape and its upper part fuses with the septal cartilage which forms the nasal septum. The superior margin of this cartilage is attached to the nasal bone and the frontal process of maxilla. The major alar cartilage or the lower lateral cartilage is present below the upper lateral cartilage. Around the nostril or the anterior nares, it curves and it has three parts. They are a medial crest, an intermediate crest and a lateral crest. The medial crest is also called as the septal process which is connected with the antero-inferior part of the septal cartilage. The intermediate crest and the lateral crest forms the margins of the nostrils. 2 to 3 minor alar cartilages are present inferolaterally to the external nose and supports it. These are the bony and the cartilaginous framework of the external nose. The skin overlying the external nose is thin and movable over the bony part, but it is thick and adherent in the cartilaginous part. It also contains the sebaceous gland and the sweat glands. Hence, boil and acne are more commonly found in the external nose. The muscles attached to the superficial fascia of the nasal part are the procerus, nasalis, depressor septi and levator labii superioris alacqui nasi. The nasalis has a compressor nares and dilator nares which helps in the inspiratory action. The contraction of the dilator nares of the nasalis and the depressor septi shows the emotional action of anger. Now, coming to the blood supply of the external nose. It is supplied by the lateral nasal and the septal branches of the facial artery in its lower part the dorsal nasal branch of the ophthalmic artery in its upper part and the infraorbital branch of maxillary artery in its intermediate part. The venous blood is drained by the facial vein and the ophthalmic vein. Part of the nose is included in the dangerous area of the face, where any infection in this part will easily spread through the valvulus facial vein into the cavernous sinus, which is a very dreadful condition. Nerve supply of the external nose. The cutaneous innervation or the sensory nerve supplying the nose is by the external nasal and the infratrochlear branches of the ophthalmic nerve in its upper part and the infraorbital branch of the maxillary nerve in its lower part. Most of the lymphatic drainage is into the submandibular nodes. Few lymphatics also drains into the parotid nodes. Coming to the next part of the topic, the nasal cavity. The nasal cavity is an irregular space which is present between the roof of the mouth and the base of the cranium. It is the widest and vertically deepest in its central region and is divided by a vertical midline osteocartilaginous nasal septum into two parts. The bony part of the septum will reach the posterior limit of the nasal cavity. The cavity extends anteriorly from the anterior nares or the nostrils, which is cartilaginous in nature, to the posterior part, which is an oblong shaped opening called as posterior nares or the choana, which is bony in nature. Each half of the nasal cavity has a vestibule, a roof, floor, lateral wall and the medial wall or the septum. Let's see about each and every part. Nostril or the anterior nares, which forms the anterior part of the nasal cavity, is formed of cartilages. Medially, it is formed by the mobile part of the septal cartilage and by the septal process of the major alar cartilage, while the intermediate part and the lateral part is formed by the major alar cartilage. The nostril is kept patent by the U-shaped alar cartilage and also it is controlled by the compressor and the dilator muscles. Choana or the posterior nare is a posterior part of the nasal cavity through which the nasal cavity communicates with the nasopharynx posteriorly. It is an oval or oblong shaped opening about 2.5 cm in height and 1.25 cm in width. It is made up of bones. Medially, it is bounded by the posterior free margin of the omer, laterally by the perpendicular plate of the palatine bone and the medial pterygoid plate, above by the vaginal process of the medial pterygoid plate and below by the horizontal plate of the palatine bone. Next, we'll see about the vestibule, the structures forming the roof, floor of the nasal cavity. Vestibule is a small area of the nasal cavity which is present close to the nostril. This is only part of the nasal cavity which is lined by the skin epithelium, that is the keratinized stratified squamous epithelium. The rest of the nasal cavity is lined by the respiratory epithelium, which is the pseudostratified ciliated columnar epithelium. This vestibule has coarse hairs so that it can trap the foreign particles from the inspired air. It also has numerous sebaceous and sweat glands, hence furuncles, boils and acne are common in this area. The roof of the nasal cavity is narrow from side to side and is horizontal in its central part and slopes downwards in front and behind. The anterior part slopes downwards and forwards and is formed by the bones nasal spine of the frontal bone and by the nasal bones. The central region is horizontal and is formed by the cribriform plate of the ethmoid bone that separates the nasal cavity from the floor of the anterior cranial fossa. This part contains numerous small perforations that transmits the olfactory nerves and their ensheathing meningeal layers, and also has a separate anterior foramen that transmits the anterior ethmoidal nerves and vessels. The posterior part slopes backwards and is formed by the anterior and the inferior surfaces of the body of the sphenoid bone. The posterior part is continuous with the roof of the nasopharynx. The floor. The floor of the nasal cavity is smooth and concave transversely, and it is formed by the palatine process of the maxilla that articulates posteriorly with the horizontal plate of the palatine bones. Hence, the floor is formed by the palatine process of maxilla and the horizontal plate of the palatine bone. Anteriorly, in the intermaxillary suture, there is a conical depression called as incisive fossa in the floor. On either side of the incisive fossa is the lateral incisive foramen, which transmits the nasopalatine nerve from above and the greater palatine vessels from below. Until now, we were talking about the anterior nare or nostril, the posterior nare or the choana, the vestibule, the roof and the floor of the nasal cavity. Now we should see about the most important lateral wall and the medial wall of the nasal cavity. The lateral wall of the nasal cavity is formed by the following bones: antero-inferiorly by the maxilla, superiorly by the labyrinth of ethmoid, posteriorly by the perpendicular plate of palatine bone and inferiorly by the inferior concha. The bony lateral wall, covered by the mucous membrane of the respiratory epithelium, projects medially as a curved plate, forming three nasal concha or the turbinate bones. They are superior concha, middle concha and inferior concha, where the superior and the middle concha are parts of the ethmoidal labyrinth while the inferior concha is a separate bone. Each of these conchae curve inferomedially, roofing a groove or a meatus present on its undersurface. The inferior conchae presents a lower free margin that ends about 1.25 cm in front of the auditory tube opening present in the nasopharynx. The space undercovered the inferior concha is the inferior meatus that receives the termination of the nasolacrimal duct. Likewise, the space undercovered the middle concha forms the middle meatus, which presents so many features. A bony bulging called as bulla ethmoidalis is present in the middle meatus, which contains the middle ethmoidal air sinuses. It receives the opening of this sinus. Below the bulla ethmoidalis, there is a crescentic shaped space called as the hiatus semilunaris, which receives the opening of the maxillary sinus. From the anterior part of the hiatus semilunaris, a mucous diverticulum called as ethmoidal infundibulum extends upwards. This receives the opening of the anterior ethmoidal sinuses, while the summit of the infundibulum receives the opening of the frontal sinus. Thus, the middle meatus receives the maxillary sinus, frontal sinus, anterior and middle ethmoidal sinuses. Anterior to the middle meatus, there lies a depression which is called as the atrium. This atrium lies above the vestibule. The atrium and the vestibule is separated by a mucocutaneous ridge called as Lyman nasi, while above the atrium there is one more mucosal ridge called as agar nasi. These are all the features present in the middle meatus. The superior meatus present on the undersurface of the superior concha receives the opening of the posterior ethmoidal sinuses. Sometimes the area intervening between the superior concha and the nasal roof contains a supreme meatus which has a depression called as a sphenoethmoidal recess. This recess receives the opening of the sphenoidal sinus. Hence, the importance of the lateral wall is that all the paranasal sinuses opens in the lateral wall of the nasal cavity. Blood supply of the lateral wall. Generally, the arteries in the lateral wall are arranged in four quadrants. They are antero-superior, antero-inferior, posterior-superior and posterior-inferior quadrant. The anterior-superior quadrant gets the branches from the ophthalmic artery, which is nothing but the anterior ethmoidal artery, while the rest of the three quadrants gets the branches from the maxillary artery. The antero-inferior and the posterior-inferior quadrant gets the branches from the greater palatine artery, which is in turn branch of maxillary artery. In addition, the antero-inferior also gets a branch from the facial artery. The posterior superior quadrant is supplied by the sphenopalatine branch of maxillary artery. The veins which drain the lateral wall form a plexus, which in turn empties the blood into the facial vein anteriorly, pterygoid venous plexus posteriorly and the inferior cerebral veins superiorly. Nerve supply of lateral wall. The sensory supply of the lateral wall is for the sense of smell and for the general sense, while the motor supply is for the secretomotor supply for the nasal glands and the vasomotor supply. The olfactory sense or the sense of smell, which is the special sense, is received by the olfactory nerves which pierces the roof of the nasal cavity, while the general sense from the lateral wall is received by the branches of the trigeminal nerve from the various quadrants. Hence, the general sense is received by the anterior ethmoidal nerve from the anterior superior quadrant, anterior superior alveolar nerve from the anterior inferior quadrant, the posterior lateral nasal branch of pterygopalatine ganglion from the posterior superior quadrant, and the anterior palatine branch from the posterior inferior quadrant. For the secretomotor supply, the preganglionic fibers arise from the superior salivatory nucleus, and through the facial nerve it relays in the pterygopalatine ganglion, which gives off the postganglionic fibers. They finally end in the nasal glands to give its secretions, while the vasomotor supply is given off by the sympathetic nerves derived from the superior cervical ganglion. Lymphatic drainage from the anterior half of the lateral wall is drained into the submandibular nodes, while in the posterior half it drains into the upper deep cervical nodes and the retropharyngeal nodes. So this is all about the lateral wall. Now let us talk about the medial wall. The medial wall of the nasal cavity or the nasal septum. Again, in the medial wall, we are going to talk about the formative framework, its blood supply, nerve supply and the lymphatic drainage. Unlike the lateral wall, which is entirely bony in nature, the medial wall is formed by both bones and cartilages. The anterior superior quadrant of the medial wall is formed by the perpendicular plate of ethmoid. Its margins articulates with other bones, that is, upper margin with the cribriform plate of ethmoid, anterior superior margin with the nasal spine of frontal bone and the nasal bones, anterior inferior margin with the septal cartilage, posterior superior margin with the sphenoidal crest, and posterior inferior margin with the vomer. The posterior inferior part of the nasal septum or the medial wall is formed by the vomer, which is a quadrilateral shaped bone. Its margins also articulates with the following bones: the upper margin with the sphenoidal rostrum, the lower margin with the maxilla and the palatine bone. The posterior margin is free, which forms the medial boundary of the choana. The anterior margin articulates with the perpendicular plate of the ethmoid. These two are the principal bony framework of the nasal septum, while the accessory bones contributing the medial wall is sphenoidal crest and its rostrum, the palatine process of maxilla and the horizontal plate of palatine bone. Now let's see what are the cartilages making up this medial wall. The anterior major part of the nasal septum is formed by the septal cartilage, which is also quadrilateral in outline like vomer. Behind it articulates with the perpendicular plate of ethmoid bone and the vomer, and in front with the upper nasal cartilage and the alar cartilage. The anteriormost part of the septum is mobile in nature and is formed by the septal process of the lower nasal cartilage or the alar cartilage. This is covered by the skin. Sometimes a vomeronasal cartilage intervenes between the vomer and the septal cartilage, which contains a mucous pouch called as vomeronasal organ of Jacobson. This receives the olfactory nerves and is lined by the olfactory epithelium. Mostly these vomeronasal organs are rudimentary in humans, but it is well developed in rabbits and dogs. The blood supply of the medial wall. It is generally considered in three parts: anterior superior part, posterior inferior part and the mobile part of the septum. The arteries which supply the anterior superior part is by the anterior ethmoidal branch of ophthalmic artery. In the posterior inferior part, it is by the sphenopalatine branch and the greater palatine branches of the maxillary artery, while the mobile anteriormost part is supplied by the superior labial branch of facial artery. A small area in the anterior inferior part of the septum is highly vascular. This area is called as Kieselbach's area or Little's area, which receives the branches from the facial artery, the long sphenopalatine artery and the terminal branches of the greater palatine artery. They all anastomose with each other. The importance of this Little's area is that when any small ulcer affecting this area or if any injury occurs in this area, it causes profuse arterial hemorrhage because of its high vascularity. So this condition is called as epistaxis. The venous drainage is by four veins. They are the superior ophthalmic vein, the pterygoid plexus of veins and the facial vein from the anterior superior, posterior inferior and the mobile part of the septum respectively. While in the upper part of the septum, the veins accompany the olfactory nerves and drains into the inferior cerebral veins. Nerve supply of the medial wall. The upper part of the nasal septum is called as the olfactory zone which is supplied by about 15 to 20 bundles of olfactory nerves. They receive the sensation of smell, while the rest of the nasal septum is supplied by the nerves of the general sense. The nerve of the anterior superior part is the anterior ethmoidal branch of nasociliary nerve. The intermediate part is by the long sphenopalatine branch of pterygopalatine ganglion. The posterior part by the short sphenopalatine nerves, nerve of pterygoid canal, and the nasal branches of the greater palatine nerve. The anterior inferior part is supplied by the anterior superior alveolar nerve, while the mobile anterior part is supplied by the external nasal nerve. The anterior part of the nasal septum drains its lymph into the submandibular nodes and the posterior part into the retropharyngeal nodes, while the upper part, the lymphatics accompany the olfactory nerves, and through their perineural sheath they drain the lymph into the subarachnoid space. And this is why any infection in the olfactory zone can easily spread into the brain and cause meningoencephalitis because of this connection through the perineural sheath. Clinical anatomy of nose. Generally, the examination of the nasal cavity is carried out by inserting a speculum either through the external nares or the nostrils, or by means of inserting a mirror in the pharynx. In the later cases, the choana and the posterior part of the septum can be visualized. One of the most common facial fracture is the fracture of the nose. This is because of the prominence of the nose, and it occurs during any automobile accidents or in any sports events. Nasal fractures may cause disruption of the bones and cartilages, leading to the disfigurement of the nose. When the injury is a direct blow, it may result in the fracture of the cribriform plate of ethmoid bone also. Mostly the nasal septum will not divide the nasal cavities into two equal halves, but this deviation will not be prominently seen. Sometimes the deviation will be so severe that the nasal septum will come in contact with the lateral wall of the nasal cavity. This condition may be acquired or may be congenital. Due to this condition, there will be obstruction of breathing and also exacerbation of snoring will also occur. The nasal septal deviation can be corrected surgically nowadays. Inflammation of the nasal mucosa is called as rhinitis, which may be acquired due to bacterial infection, viral infection, or may be due to allergic reactions. The swelling of the mucosa is because of its increased vascularity. The infection of the nasal cavity may even spread to the anterior cranial fossa through the cribriform plate of ethmoid, or into the nasopharynx posteriorly, or into the middle ear through the pharyngotympanic tube. Because of the connection of the paranasal sinuses with the lateral wall, rhinitis may also lead to sinusitis. Epistasis or nosebleed is relatively a common condition. It may result due to trauma or infections or in hypertension also. In children, the epistasis may occur due to nose peaking. The nose bleeding is commonly occurring in the anterior third of the nasal cavity, that is the Kieselbach's plexus or the Little's area, because of the high vascularity. These are some of the most common clinical conditions manifested in the nasal cavity. Thank you.